Hello everyone. Today we will go through an exercise to improve mobility and reduce pain in the lumbar spine area. All joints in the human body can be conditionally divided into those prone to instability and those prone to stiffness. Well, for example, the ankle joint is often prone to stiffness while the knee is often prone to instability. The lumbar joint, on the other hand, is often prone to stiffness. Such joints in the human body are usually alternated. Some provide good support, others allow good movement. Unfortunately, when joints prone to stiffness become too stiff and immobile, pain develops in them and this overloads other joints. If you have pain in the area of the sacroiliac joint, right here, yes, by the way, it's right here, not here. The hip is located here, then you can consider an exercise to improve its mobility. Most often, we see a situation where the head of the joint goes too deep into the pelvic bone. The musculature around the joint spasms very actively, the joint capsule may even be stretched, and as a result, the sacroiliac joint reduces its mobility. Arthritis often develops against this backdrop. These exercises can be very helpful for patients with first and second stage sacroiliac joint arthritis. The first exercise will be aimed at stretching the muscles. Approach a high stool or table. Next, we put our foot on a high support. I will show several options depending on how well your joint bends. Put your foot down and start leaning forward slowly. To the right or to the left. Choose the direction that is most limited and it best stretches the muscles in the buttock area. For me, this is the direction with a slight tilt to the right. You can stretch like this for about 30 to 40 seconds or use the push-relax technique. How to use this technique? When we are in this position, press your foot against the table. When you engage your muscles, there might be an uncomfortable feeling in the groin area. Hold for 5 to 7 seconds, then exhale and relax. After this, you can lower yourself closer to the foot. Next, we apply pressure again with the foot downwards onto the cushion, hold for 5 to 7 seconds, then relax. And after that, we can go a little further down again. If it's hard for you to lift your legs so high, you can do a variation of this exercise while sitting. In this variation, you can work through the leg, pulling it towards the opposite shoulder, as well as try to lean your torso forward. Be sure to pay attention to the fact that when performing this exercise, you should have good posture. In this exercise, we will also mobilize the sacroiliac joint and stretch the gluteal muscles, but already under weight load. That is, with support on the leg that we want to work on. For this, stand near the wall, take one hand to the wall. We stand on the leg we are working with and twist the pelvis in such a way as to stretch the gluteal muscles well. In this way, our middle gluteal muscle is very well worked out. Do 10 movements and hold the last repetition for 30 seconds. Additional gluteal muscles can be worked out with the help of a foam roller, ball, or percussion massager. To work with the roller, place the roller in the gluteal muscle area. Move your leg into the position we stretched in the previous exercise and start slowly rolling the roller over the gluteal muscles. The roller provides a good massage effect, but it's not deep enough. If you want to deeply work the trigger zones, you can use a tennis ball. And from the same position, we apply a more precise effect, placing the ball on the most painful zones. I do not recommend you to move actively on the ball. We rather press the points for about 30 to 40 seconds. After the pain passes, you can rise, move the ball to another area, and press again. During the pressing of particularly painful points, you may feel how the pain or numbness can shoot down the leg. This is a normal sensation if it passes right after the pressure is released. After we have worked the muscles, it is necessary to improve the range of motion in the joints. And as I've already said, the main problem is compression inside the sacroiliac joint, so we will be improving mobility against the background of decompression. We will use a rubber expander for this. The first thing we will improve is the external rotation of the thigh. For this, secure the expander to a stationary object, for example, a battery, and wear it in such a way that it is as close to the hip as possible. Next, stretch the expander, position your leg in such a way that the pull is performed at a 90-degree angle to the thigh. Increase the tension and perform the movement with your knee, inward and outward. Inward and outward. You can also connect a mouse component here. When you go knee outward, you resist with your hand. Push your leg outward. When moving inward, you relax. Push outward and relax inward. Push outward, relax inward. Repeat this about 15 movements. The next exercise will improve the internal rotation of the thigh. For this, stand in such a position and slightly move the thigh into the position of internal rotation. For this, you need to move your foot to the side and from this position start to slightly tilt your pelvis in the opposite direction. Repeat this 10 to 12 times. After this, try to increase the angle of the internal rotation. After 10 repetitions, try to increase the angle of internal rotation to the maximum and perform the exercise again. The next exercise can also help improve flexion in the hip joint. Stand on your toes, stretch the rubber expander to the maximum and perform the movement back under the tension of the rubber expander. Try not to lose the tension on the rubber band. To avoid losing tension, you can slightly fall to the opposite side. For the next exercise, we will need a belt, not a rubber band. We adjust the strap in such a way that we can place the belt on the bent leg on the stool. And at the same time, the supporting leg was standing on the belt loop and was slightly bent. When the supporting leg is straightened, the belt begins to press down intensively on the thigh bone, stretching the joint downwards. In this way, we can exert a gentle stretching effect on the joint downwards by straightening the supporting leg. You can also do this 10 to 15 times and slightly bend your torso closer to your thigh. When you come closer to the thigh, repeat the straightening of the supporting leg again. After this, try again to bend deeper and again perform the movement in the supporting leg. These exercises are used 1 to 2 times a day for 2 weeks to improve the range of motion in the lumbar spine. It's good to perform them before the main sports load, and they can also be combined with other strength exercises. I hope this set will be useful for your hip joints. Good health to everyone!